So when we had not just so many more cases coming in, but if you recall, there was a backlog in the data download from the state, and I'll talk about that more in a minute. That actually caused some increased stress on our system and our ability to reach out in 24 to 48 hours. And we also then had to prioritize. If somebody was already through isolation, calling them wasn't as much of a priority as someone earlier in isolation. And we worked with the state on that prioritization. We are looking at data week to week at the percentage of people that we contact in 24 hours and 48 hours. So the last time we pulled the data, about 40% of individuals we were able to contact within the 24-hour period, and that increased to somewhere over 60%, I don't recall the exact number, at the 48-hour mark. We do have people who don't answer the phone. So it's really important to think about the need to, the purpose of contact tracing is to identify the case and have them isolated, but the contacts and get them quarantined. So it's really important that people understand if they test positive, they need to be isolated for 10 days, and they need to help us identify who their contacts are. But really what I wanted to address is the overall sort of process so that people can see the actual times. So we know the lab turnaround times now are between 1 and 3 days, most of them less than 2 days. So if someone's tested on the first day, they're going to get their results back from the lab, likely by that day, 24-hour turnaround or 48-hour turnaround. The lab also then reports to the state health department, which is different than most infectious diseases. They report generally locally. So it gets reported to the state health department, and it may be another 1 to 3 days before it comes to the local health department. So there are times when we receive the report, the person was already tested 4 or 5 days earlier. So there's several layers in that. I do want to reinforce that the labs are turning around the data really quickly and getting that out to the customers who were tested. They're also reinforcing when they notify someone that they're positive that they need to be isolated or quarantined. We will continue to monitor our turnaround times and, as needed, adjust our staffing to be able to meet the needs of our community as our numbers go up.